Hi everyone, and welcome to another Body Talk with Rachel video, where I, along with special guests, talk about body image issues among different groups. I'm Rachel McIntyre. I'm a doctoral intern at the Counseling Center, and I use she, her, hers pronouns. Today, I am joined by Dr. Megan Lynch, a staff psychologist here at the Counseling Center, as well as Claire Cusack, a graduate assistant at the Counseling Center, as well as clinical psychology graduate student. And we're going to have a conversation today on research and clinical findings regarding body and eating concerns among the LGBTQ plus community. So I'm excited to have this conversation and for both of you to be joining today. Would you first like to introduce yourselves and share a little bit about your work and interest in this area?
Sure, I'll go first. So as you said, I'm Dr. Megan Lynch. I'm obviously one of the counselors at the Counseling Center. I do use she, her pronouns. Prior to coming to the Counseling Center, I did a number of internships when I was going through doctoral school or clinical psych school. And I ended up coming to the field of body image and eating disorders because I had an internship site where I worked with an eating disorder program where we would serve inpatient, partial hospitalization, and intensive outpatient. And I found out I had a real knack for the community. I really liked leading groups. And so that's kind of a little bit about just my interest and work in this area thus far.
So I'm Claire. I use she, they pronouns interchangeably. Gender isn't that salient to me. So really either is fine. As Rachel mentioned, I'm a graduate student in the clinical psych program, and my research and clinical interests focus on eating disorders in the LGBTQ community. And so far, that work has looked like examining different appearance ideals, specifically androgynous appearance ideals, among sexual and gender diverse participants, as well as examining relations between eating behaviors and minority stressors. And I think what drives my interest in this topic is the high prevalence rate of eating disorders and body image concerns among this group, and the fact that a lot of sexual and gender diverse individuals are underinsured and lack access to care. And so I'm really hoping that my research chips away at those sort of systemic barriers to inform policy.
Great, that's wonderful. Thank you both for sharing. And I hope this conversation and video is one small step in providing a bit more awareness and chipping away between maybe some of the barriers to access to care for some too. So just to note that our conversation today is pretty brief in relation to this broad topic, which is body and eating concerns among the LGBTQ plus community. We're definitely going to note research findings, though there's of course limitations to research that will be acknowledged, and as well as clinical and personal insights as well. So please just take that for what that is, and note that there is definitely going to be missing perspectives in this conversation. And to start out, this video series was really motivated because of the lack of inclusivity often found in the body and eating world in research as well as clinical work for members of the LGBTQ plus community, among other groups as well. So I really want to spend time talking about the prevalence of eating and body concerns among this group, and maybe what relates or contributes to the increased risk among this group as well as sub-communities. So just to start us off, what are some initial thoughts about the high rates or perhaps high rates of body and eating concerns among the community?
Yeah, I can start with this one. One of the things that initially jumps to my mind is this national study done by the Trevor Project and the National Eating Disorders Association in 2018. And this large sample, they found that among LGBTQ plus youth, that like over half of individuals had a diagnosed eating disorder, and then that jumps up to 75% of an undiagnosed disorder. And so that is just so alarming to me. And I mean, it begs the question of like, well, what's going on? Or what is the why? And so my initial reaction, I would say, is shock, and then following is like real sadness, I suppose. Um, However, I always frame this as like identity isn't, I don't see identity as a risk factor in and of itself. Like, no, identity doesn't cause an eating disorder, but what are the lived experiences of living with certain identities that may position you at higher risk?
I also echo some of that sadness, and I do agree with you. I don't think that having a particular identity is what is the cause of the eating disorder. It is more based on like the lived experiences that you have. There's also additional layers of societal pressure to conform. And so I think because of those different factors and how complex like body image and eating disorder and all these things kind of layer together, that possibly has some nods to why it's so high among the LGBTQ plus community.
Yeah. And I was just thinking of when you mentioned societal pieces, it makes me think of the tripartite model, of body image, which is a common like risk that says that when you have these pressures from like family and friends and the larger society, you might be at increased risk. But knowing that LGBTQ plus individuals exist in that larger society, but also have different standards, like how do we understand risk in the context of gender and sexual identity specific factors? And I think that's really lacking. Like we could say all day that cisgender women, heterosexual women value thinness, but does that hold across different groups?
Yeah, that's a really good point, to think about the impact of these different influential sources, but maybe additional sources and stressors of members within the LGBTQ plus community.
Yeah, and you're kind of right. Like if we only use the marker of thinness, that I think probably attributes to some of that like 75% of undiagnosed eating disorders, because like if we're just using that as the standard and somebody doesn't necessarily think that they're falling into that or like aiming for thinness, then some of like the measures might not pick up on that person.
Yeah. And I think personally, as a queer person, like when I hear things such as, oh, well, there's this appearance standard, and it's like, well, I don't want that. I never wanted to assimilate to this standard. And so I imagine I'm not alone in that. And so it's like, I feel like there are different standards within certain groups that might have unique stressors. Like I know you've spoken with Dorian Holliday about gay men, and there might be some lean muscularity there, whereas what is the case for queer women? And I think that might also vary by gender expression, and I think that's kind of where you could see sexual identity and gender expression sort of meeting, whereas different people express their gender in certain ways, where someone might express it more masculinely versus femininely versus what I look a lot at, which is androgyny. And so how does that relate to how someone feels in their body and how they behave with their food?
Yeah, that's a really great point. Just want to put a plug that Dorian Holliday did graciously do a Body Talk with Rachel video and share about body concerns among gay and bisexual men. So please check out that video if you haven't already for more information about that subcommunity of the LGBTQ plus broader community. But of course, we can still, acknowledge and share information as well in this video. It makes me think, as you acknowledged, Claire, that there's many differences among subcommunities. and then maybe the intersection of sexual orientation and gender expression as well. I'm thinking about, what does the research tell us, or what might be some clinical insights of subcommunities who might be at increased risk, and maybe what are some of those body messages that they're receiving?
Right. A couple of things that come to mind initially. Dr. Melissa Simone at the University of Minnesota has done some work examining eating and body concerns among sexual and gender diverse individuals, and their work suggests bisexual women are at really high risk for eating and body concerns, and that's also supported by some qualitative work done by Huxley and Clark. And one of the ideas there, I think, could be this idea of like an invisible identity. And so sometimes bisexual women aren't seen within the queer community, or not seen as queer enough, or may express their gender in ways that are aligned with how society expects them to, such that bisexual women may express their gender with more femininity. So it could be having that pressure of the femininity, but also the pull with the LGBTQ plus community of wanting to be seen and identities validated, could be one idea, I think.
Mhm.
Yeah, and I would reflect on some of those too. I do think that there is a lot of research showing that like sexual women do have a higher rate of eating and body image concerns because they do get caught in between the two communities, and then they both, like not quite enough for both, if you will. And there is some shift in some of that, but not fast enough, in my opinion. And I think it leads to probably feeling inauthentic, where their particular expression is possibly more leaning towards femininity, which might make them invisible to, like, if they're trying to attract cisgender women. Those are just some of my jumbled random thoughts to jump onto Claire's.
Yeah. And it's kind of interesting. Henrik Sachs and Dr. Seismansky examined eating disorders among lesbian women looking at gender expression. And their work suggests that a more masculine expression could be was associated with fewer concerns. So, I mean, that could be a protective factor, which it might not be, masculinity in and of itself, but the idea of just eschewing the gendered norms, or the binary gendered norms specifically, could help in the sense of, like, perhaps if you don't buy into the larger diet culture, that could help some queer women specifically.
Mm-hmm. Yeah, there is definitely a lot of mixed research on, is the lesbian community protected from some of these different things? And I think specifically, I can't remember what article, but it saying that among women, like, the standard of beauty is closer to strong, athletic, muscular for some subcommunities. So maybe opposing some of the traditional society beauty standards in that way, or maybe the part of the protection.
Yeah, and I think that's also tough because, like, I mean, part of what might make it mixed is just having a standard at all is a problem. Could be a problem if you're rigidly striving, towards something in a way that makes you feel badly about yourself and engage in food in ways that are unhealthful, then perhaps it's not the specific standard that's the problem, it's just the standard, whatever the standard is. So, like, I'm thinking of androgyny for people who may express their gender androgynously. Some people report what androgyny means to them is like this skeletal, like, agender frame, prepubescent body, and that's also really associated with thinness. So, like, thinness means different things to different people. So whereas someone may be like, oh, well, thinness helps me feel affirmed in my femininity, someone else may be like, thinness helps me feel affirmed in my androgyny. And I think that nuance is so important to see how someone feels about their body. Actually, like, what are you actually communicating when you say thin? I don't know, and I don't know if we can put a blanket statement on what these standards mean.
Yeah, you're highlighting that subjectivity is like the main point in that.
Yeah, that's so true. That's such an interesting point, that there's different ideals that people are, looking or being influenced by in their bodies, and that there's variation and perhaps similarities and overlap between them, which makes it very complex when we're thinking about the larger community and differences within sub-communities. One thought that came up for me was thinking about maybe the ideals within a sub-community that a person is a member of, but also being affected in some ways by heteronormative messages and culture at the same time. And I was wondering if you both could speak to that at all, and just thinking that maybe is part of the experience in some ways, and maybe for some more than others as well.
Yeah, that's such an interesting point. I think, yeah, it goes back to Megan's idea of like, oh, well, maybe identity, like the subgroup is a protective factor. But like the fact is, perhaps, and for some people, like the dominant culture is so large, and the dominant culture is like, it's telling you, regardless of your identity, it's telling you to have a certain body. And that body, I feel like, is also steeped in whiteness, which hasn't really come up yet. But like who sets the standards, and like how closely tied are you to like a given community, I think could be important. So maybe for some people, like the social support of the LGBTQ plus community could help improve body image satisfaction. And for other people, that same community could be a source of stress of like, oh, okay, well, I need, this sort of body to fit in with my community. And I don't know. What are your thoughts, Megan?
Yeah, I think that goes back to like the subjectivity of like, okay, like being a part of a community or a sub-community could be the protective factor because there's power in numbers, right? But then on the other flip side of that, like, going back to like my point I was talking about earlier about like inauthenticity or not being seen for bisexual women, if being a part of the community and you want to be recognized as part of the community, what do you have to look like in order to meet that hidden standard, I guess.
I will say in my experience that I feel like the queer community I've cultivated and built seems to have really diverse body shapes represented and sizes, and also is welcoming of body diversity. I don't know, like, I don't think my experience is everyone's experience, but I am grateful that it exists in a sense. I think another flip side of that is though, like I sometimes feel like the queer community experiences pressure to move as a monolith. So it's like, okay, well, we're rejecting these standards, so I have to reject these standards. But what if you are still struggling with these like heteronormative dominant ideals of body? Like, can I say this to my queer group? Will they think I'm less politically engaged or like shallow or some things? And then maybe someone would hide concerns because it doesn't fit like a queer culture of body acceptance, if that is like what queer culture, if that is what your queer culture looks like. Mm-hmm. I don't know if that made sense.
Yeah, I think it made sense to make sure that I'm tracking. So like there is this pressure to come, like if you're in the queer community, like conform to where the mass is moving. So like the monolith, like, okay, like we're all going this direction. And if you have something or struggling with something that's counter to that like direction that we've said we're going, you may be way less likely to talk about it for fear that it would have almost like a consequence, like you'd be rejected from the community.
Right.
Yeah, that's a really great point. It brings me to a question that I know we were going to get to later, but maybe we can talk about it now and then circle back to others, which is what are the barriers for members of the LGBTQ plus community to be accurately or adequately assessed and receive treatment for body and eating concerns, and maybe the perception that body and eating concerns are not part of the LGBTQ plus community in some ways might contribute to that. But of course, would love to hear your thoughts and opinions.
I have a couple of different thoughts, but I'm just kind of remembering earlier Claire saying is some of the barriers to access to care have to deal with being underinsured. But I was thinking about my time at where Linden Oaks was the eating disorder program that I worked at, and I'm glad that it was incredibly accepting and knowledgeable about the trans community and the LGBTQ plus community, but not every treatment center is that way. And so I think that I would throw that in there as another possible barrier to care, is that like, depending on where you are, maybe geographically, you might not have treatment centers or providers that understand you or are accepting of you.
Yeah, I think the competency issue is pretty large, and might come with some assumptions of like maybe even some that we've said earlier in this video of well, bisexual women may express their gender as femininity, or like masculinity may be protected, and so perhaps like those our own biases or assumptions may cause that. And then I think on the flip side, it's trying to map on assessments and conceptualizations based on cisgender heterosexual women, map those ideas onto individuals with different identities. And when it doesn't fit, it's like, oh, well, what do I do? And those like barely fit, the cisgender heterosexual women, if we think about our classification and assessment system. So, and how many people fall in OSFED, for instance, still. So I think that could be a barrier, that clinician piece. And also I wonder, I think sometimes with body and eating concerns, it's so normative to have them. And I don't know if this is specific to like the queer community, but like, when is it bad enough to get help? How sick is sick enough to get professional support on these concerns? And I think that could also be a barrier of like, oh, well, I don't have X, I'm not this weight, or like I don't engage in the behaviors at this frequency, or like, well, some days are okay. And so it's like, well, how do I know when? And I think what I think of that is like, any time is a good time to stop suffering, and so like, yeah, you can do, you can stop digging at any time, basically.
I like that suggestion, that work can be done at any point on the continuum of experience.
Mm-hmm.
I also know from the conversation I had with Dorian, where he described certain behaviors that we would consider disordered eating behaviors to be normative in the gay community, and that to be really infused in daily conversation to a point where it would be difficult to determine like what's normal, that this is what all of the people I talk to are doing. If they're not seeking help, why would I seek help? Perhaps mentality.
It just ties back in the subjectivity of it all.
And that is the theme of the conversation, is there's so much subjectivity. I also know from my work in a residential facility when I was before graduate school as a just mental health counselor, like supportive role, that treatment place was very much dominated by white hetero-cis women. And it was pretty notable that there were a handful of older women at the facility, and them noting that their experience felt much different from the younger individuals in that facility, and how that made it challenging for them to have gains similar to maybe the younger cohort of individuals based off of that peer connection experience. So I'm just, as we've been talking about, it made me think of how maybe those individuals identified with maybe heteronormative ideals and still struggled with some of our treatment approaches and care in that way, and how that can potentially be really compounded for members of the LGBTQ plus community.
Yeah, I've the past year I've been working with an undergraduate student on their thesis, and they're studying trans individuals' experience in eating disorder treatment, and it's a qualitative study. And some of the things that people mentioned, and these are trans individuals who have received care, right? So this is less so barriers to accessing it, but problems once you access it. But like the fact that gender isn't talked about in treatment, all of the examples are geared toward cisgender heterosexual women. There's an assumption that you are a cisgender heterosexual woman just by like use of pronouns, the worksheets used in groups, and similar things like that. There's also people reported like, oh, I wasn't allowed to talk about my sexuality at meal times, or and that seemed kind of problematic. So it's like, then others expressed that providers assumed that their gender and sexual identity were the cause of their eating disorder. So like, which, you know, in some cases people do engage in eating behaviors to manage gender dysphoria. But like, that's not the case for everyone, and eating disorders may onset before gender dysphoria. So what, you know, by having these harmful stereotypes of like, what is the cause, and then ultimately, how does that inform treatment? Could be an issue, which goes back to the competency piece that we spoke of earlier.
Yeah, it almost kind of seems like in treatment, there is an additional perpetuation of like societal standards. And if you don't kind of fit that box, like they don't know how to adjust treatment to help you.
It's a really unfortunate, factor in treating in this field. I'm just sitting with that, and also sitting with, there's a lot of reasons for members of the LGBTQ plus community to not seek help, either not adequately assessed or informed, or not receiving then adequate care. Are there any like messages of hope to help us switch the script in some ways? It's okay if there's not too, because it's important that we're realistic as well.
Mm-hmm. I know that there's some work that suggests finding like feeling comfy in identity and working through that could be helpful, especially for queer cisgender women, of being like, oh, in my therapy, like I found a sense of like a feminist identity. And so in a sense, like political ideas and ideologies helping with that. So, I mean, that's hopeful, but also I think, yeah, just accessing like adequate care. We see eating and body image concerns improve, right? When people have gender affirming care, when clinicians are competent in gender and sexual identity. So I mean, I think it's possible, and it happens, right? Like there are people who feel okay and feel good and even euphoric about their bodies and have like a positive relationship with food. I think that needs to be said. So even though it's so normative, like this discontent and these issues are way too pervasive, it is in fact possible to live a life not consumed by that distress.
Yeah. And I would say also too, within the eating disorder field of research, it is a bit more on people's radar. Like, hey, we can't just keep trying to treat people as using the same measures that we've used on cisgender heterosexual women. So there is some expansion in that area, as well as like hospital systems getting on board with use of pronouns and names and not dead naming people when they're in treatment. So there are some treatment centers that are getting way more focused on that, but I think realistically, there's probably more treatment centers out there that are still kind of following the previous standards, but it's up and coming.
Also, I just thought of it, but Doctors Tiffany Brown and Aaron Blashill have done some work with a prevention study called the Body Pride Project, and that targets the internalization of these different ideals, and it's been found to be effective in improving eating and body image outcomes for specifically sexual diverse individuals.
That's really great that there's work being done to develop these interventions and they're shown to be effective. It gives some hope that there's progress being made, which I hope is a message that people are carrying as they're watching, but still keeping in mind a lot of the barriers that we talked about earlier, of course, still exist.
And I think something that will be important moving forward to improve the body image satisfaction and eating concerns among the queer community is, like, in this research that we're talking about, is actually involving the community in that. And so, like, having community informed approaches and engaging with them, and also engaging with people with lived experience. I think this field is not one that does it well of valuing the lived experience of those with eating and body image concerns. However, we can test studies till the end of time, but if we're not using the lived experience, or like building up the lived experience of those who are actually affected, then we're still like falling into the same traps of mapping on the existing norms rather than adapting. And maybe, I don't think everything that we know about eating and body image needs to be scrapped, but I'm saying we don't know until we do more inclusive research, which involves including the people with those identities from the onset.
That's such a great point. It's so important that they're involved in the work. How do we know interventions are effective or research is inclusive if it's not truly inclusive of the lived experiences of people? So we've talked about a lot of things, and I know that there's been maybe some tension of talking about the community broadly and balancing of the subcommunities. I want to just give space if there were areas or aspects that we want to provide more attention to before transitioning to the last question, which is maybe some direct take-home thoughts about strategies that people watching who might be struggling with body and eating concerns could try or consider as they're progressing in their journey of body acceptance. So I just want to leave space if anything else comes up, knowing that tension is there of like, there's probably so much to include and not enough time.
Yeah, something that always comes to my mind is in thinking of trans and non-binary individuals. Like I briefly mentioned earlier that sometimes eating disorder symptoms can be used to manage gender dysphoria. So for instance, someone may engage in restrictive eating patterns to minimize curves that would be associated with femininity, um, or else someone may engage in restrictive patterns to accentuate curves to actually endorse femininity. And I think that, when we conceptualize these behaviors and people use words like adaptive or maladaptive, like these behaviors are risky, restrictive eating patterns are risky. And also, I mean, in this case, it could be very adaptive to feel affirmed in your gender identity. So I think it involves more complex conceptualizations of just like, dichotomizing adaptive, non-adaptive. I think that there's a lot to be said of um, living your truth. And it's just, how do we do that in a way that isn't risky or as harmful to our bodies, but is still really, but still in ways that we can be affirmed in ourselves. And so, I don't know, I just like to say that because like sometimes behaviors pose a risk, and sometimes they serve a function, and that's survival. And so it's I think that's important to hold.
Mm-hmm. The incredible amount of nuances that go with treating disorders among LGBTQ plus individuals and all individuals, really.
Mm-hmm. Yeah, that's a really great point of the nuance of what is maladaptive and adaptive. Any suggestions for helping individuals maybe assess whether a behavior that is adaptive or maladaptive for them in that context? Knowing that we're not including all perspectives, of course, there's so much nuance, but any tips to help someone differentiate?
Yeah, it's so tough because I would be like, well, how do you feel? Are you distressed? And then, but eating disorders and body image concerns can be so like egocentric in a way of like, no, I'm not feeling distressed. I feel good. My body is the way I want it to be. And so that can't always be a reliable marker, I'd say. But yeah, I don't know. I think some like really honest processing with like a therapist, licensed therapist would be helpful. But also, I mean, trusting your gut. Like if you're distressed, you're distressing, you know it, and that's reason enough.
Yeah, that's a good point. I was thinking too of what might be like physical signs that something that a person is doing is maybe leading to more significant concerns. We see like gastrointestinal issues as maybe a sign that behaviors are harming their bodies in some ways. Maybe other 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 changes, maybe in increased hair in parts of the body that wasn't there before, though keeping in mind other reasons that there might be increased hair. I'm thinking of testosterone treatment as well. And maybe thinning hair or really dry skin, low energy or feeling dizzy or fainting would be signs as well. Please add if anyone else has thought of more. Those are the ones popping up for me.
Those are good. Like injury and continuing to exercise. And also, how do you feel when you can't exercise? Is that really upsetting? So I know that's not necessarily physical. I mean, the injury is, but like if your exercise leads to like an overuse injury, perhaps.
Yeah, I think you guys kind of highlighted where my brain was at currently. I haven't really thought of much else other than like you're pointing out like are there things that are starting to crop up that could turn into really long-term consequences that would not be very good for your health? And also too, I think the self-reflection piece, like you kind of have an inkling if you're struggling, despite maybe trying to shove some of those thoughts down or away. Like there's still there's something there that clues you in just a little bit. Trying to listen for that piece a little bit more can maybe be helpful.
Yeah, that's a really great point of really encouraging people to engage in some self-reflection when they're thinking about behaviors they're engaging in. So we've talked about maybe thinking about eating concerns and tips to differentiating them. Do either or both of you have a tip or multiple tips for people who are maybe working on their body acceptance?
Yeah. One of the ones that comes to my mind first is comparison. And like whether you're comparing up or down, it's probably not helpful. It's a losing game. And so I think like noticing, oh, am I comparing my body to this other body, like an actual body, or even this ideal, this abstract ideal, and trying to unpack, like, where is this coming from? Do I feel guilty? Like, do I think my body looks bad? Who says it looks bad? Do I trust that source? Because if the answer is who says it looks bad, and it's society or it's anyone, really, if it's anyone, is that, are we going to take that at face value? And what can we be more expansive in what bodies that are okay for us? And I think that the body where you land without manipulating your snacks and exercise is the body that's a good body, and kind of doing some acceptance work around that, and perhaps finding some functional gratitude of like, here are the things that my body does for me that are good, that may or may not be appearance related. So if like legs, for instance, are a problem area, and someone can be like, my legs help me, I went on a walk with my friend and my legs helped me do that, and that was a meaningful moment for me.
Yeah, that function over form idea, like, is the function helping you move closer to the things that you value? If you value friendship and maintaining a community, is your body helping you do that? I think additionally, it would be worth it, we talk, and I'm sure Dorian talks some about like social media and things like that. Like, can you be a little bit more mindful or curate social media that does provide you benefit rather than detriment? Also too, maybe like maybe not curate is probably not the word there, but maintaining friendships that do provide some sort of value and encouragement in your life, rather than sort of tearing you down and making you really question a lot of different things. Those are some of my initial ones. Claire, I'm sure you thought of more.
I love the idea of values. I think that's so key. Like, I don't know, if I thought of a pie chart in my values, like, and it was like family, friends, like, I don't know, service or whatever, how big is the body image pie taking up in my values wheel? And like, if it's taking up too much space, like, how can I lean into another value to increase that? Am I living in my values, essentially? And I think that can help at least ease some of the emphasis that we place on appearance. Like, we are more than a body, or even how society reads our bodies, we're more than that too. And I think that finding that sort of affirmation in ourselves, and also surrounding ourselves with others who see us, is really helpful.
Yeah, your weight is not your worth. Mm-hmm. There's so much more to you. There's so much more pieces to the pie.
Mm-hmm. Yeah, I love that. I love that. Thinking if you can build upon other slices of the pie aside from your appearance or body slice. Yeah, well, thank you both so much. This was very insightful and informative, and I've enjoyed the conversation. So I appreciate you both taking the time.
Thank you.
Thanks for having us.
Sure, thanks.